everybody, Dr. Brian Joves here with Spine and Nerve Diagnostic Center. Today we're going to be talking about chronic neuropathic pain. And so, as we've discussed previously, there are two big types of pain that we usually talk about. So nociceptive pain, which means that there is something that is currently causing tissue or structural damage that's sending pain, and then neuropathic pain. Neuropathic pain being inflammation or irritation of the nervous system that is sending signals and letting us know that we're feeling pain, which may or may not be correlated with current or ongoing tissue damage. So generally when I start thinking about chronic neuropathic pain, the things that I think about are pain that is there 24 hours a day, right? Pain that doesn't ever really go away. Because if we're thinking about something that is structural or anatomic, there are certain positions that put pressure on joints or nerves or discs, and there are certain positions that take pressure off of that. And so there are times, I think lumbar stenosis being the perfect example, where we can actually sit down, take pressure off of those nerves, and have no pain at all. But chronic neuropathic pain is pain that is always there. Yes, it gets better and it gets worse throughout the daytime, depending on activity level and depending on which positions we're in, but the pain never actually goes away. So a lot of times when we're talking to patients will say, I'm always at a 4 or 5 all throughout the day. If I do more things, my pain gets higher. If I do less things or take some medications, sometimes it gets a little bit lower, but the pain never goes away. These patients generally also have trouble sleeping because at nighttime, neuropathic pain tends to be a little bit worse. And the reason for that is that the distractions of the day tend to go away, right? And so as we're resting at nighttime, you don't have all of the inputs of other people and other things going on, and so those nerves are kind of left to their own in terms of the attention that the mind pays to them. And so, generally speaking, pain 24 hours a day, pain that does tend to be worse at nighttime for a lot of patients, and then it can get better and worse with different activities. That, to me, is chronic neuropathic pain. And so this can happen in many places within the body, right? Obviously, we are Spine and Nerve Diagnostic Center, and so spine is a very common place that this happens for patients. Other things that are very common for chronic neuropathic pain are things such as complex regional pain syndrome, which usually affects one limb, or things like peripheral neuropathy, which, most common in diabetics, but also I always like to tell patients the most common cause of peripheral neuropathy is idiopathic, which means we don't actually know what the cause of that pain is coming from. But these are some of the more common things that we see as far as chronic neuropathic pain. Now, as we start thinking about how do we deal with chronic neuropathic pain, obviously that's going to depend based off of where that pain is, right? We're going to go through our normal algorithms of doing a full evaluation, history, physical examination, try to see exactly when that pain is the worst and maybe what the original source might have been for that chronic neuropathic pain. But obviously if it's there 24 hours a day, it's not going to be quite as easy as, something like I said, like spinal stenosis, where if you take pressure off of the nerves, it stops hurting. Chronic neuropathic pain does take a little bit more work to kind of think about and to help to get better. We're going to go through our normal algorithms. And so, every time that I talk, you're always going to hear me talk about the kind of 5 big steps that we start thinking about every diagnosis, and that's no different for chronic neuropathic pain, right? First, education. Right, talked about the disease, help you to understand exactly what's going on, and then we can make a decision. Is it bad enough that it's affecting your life and we need to do something else, or do you feel like you can live with it at that point? Then we move on to our first step, which is physical modalities. And so much like every other realm of pain medicine, we're going to get you into some physical therapy. We're going to think about if there are certain ways that we can utilize bracing or topical ointments to be able to help you, or maybe even external things like TENS units to be able to help calm that pain. All of which topical, especially topical ointments and TENS units, do have some very good utilization within chronic neuropathic pain. Then moving up to medications. And so we've discussed before a lot of the neuropathic agents that are helpful, and this is usually when they tend to shine. So most commonly things like gabapentin, Lyrica, Cymbalta, but many other medications that can be a part of a nice plan to be able to help treat chronic neuropathic pain. And then as we start getting into those more interventional things, so injections and surgical options, then it starts being a little bit more dependent on what the source of that neuropathic pain is. One of the things that I will start to talk about with patients relatively early on when we're thinking about chronic neuropathic pain is neuromodulation. Right? And so just to give a little introduction, and we'll discuss this in depth in a later episode, but neuromodulation is utilizing electricity to affect the way that nerves are sending signals. So obviously, when we're talking about chronic neuropathic pain, pain that is there 24 hours a day, and coming from the nerves as a source, we do have to think about how we can change those nerves from sending those inappropriately painful signals. So medications being one of them, but electricity in the form of neuromodulation, so spinal cord stimulation, dorsal root ganglion stimulation, peripheral nerve stimulation are many of the best treatment tools that we have for trying to help with neuropathic pain. So if you have any questions, let us know. Otherwise,